That's why they spelt out VET instead of saying it. Clever. Oh well, I always get treats when I'm here anyway. Oh, hello.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
I'm back inside the vets.
As a nation, we adore our animals. So much so, 62% of households own a pet.
How could you resist that little face?
With dogs topping the pet popularity charts at 15.5 million.
Yay, good girl.
Followed by cats.
So pretty, it's beautiful.
Our feathered friends. And not forgetting 500,000 rabbits.
Hello, darling.
I'll be meeting some wonderful pets. And their owners.
Thank you so much.
Honestly, it's so good to see you smiling.
Plus, spending time with the dedicated team who look after them.
Hello. Now then, I'm going to have a listen to your ticker if that's all right.
And we step outside the clinic to visit some vets who care for all kinds of creatures.
How does that feel when you release them?
Oh, it's amazing. Yeah, it's worth it.
So, come with me, Fern Britton, Inside the Vets.
In the southwest of the UK, not far from Bristol city centre, is the neighbourhood of Henleaze. This veterinary clinic has been serving the local community for the last 6 years, run by husband and wife team Andy and Amy Valencia.
I would take a biopsy of the cyst wall and then bring him back in.
As well as qualifying in general veterinary medicine, they each have undertaken extra training in different areas. Andy holds a European surgical certificate.
This is a tricky bit. If I get this wrong, I will poke something I shouldn't poke.
And Amy has taken a keen interest in internal medicine and ultrasonography.
These grey bits are soft tissue.
Yay! Should be good.
Veterinary surgeon Dr. James Greenwood also practices here.
Hello.
They're so
You are
handsome.
Beautiful.
Yes.
You are lovely.
He has a particular interest in dermatology and dentistry.
Right, next job is to get our dental x-rays.
This incredible team have kindly invited me back into their world,
Starting to get used to this.
where I'll be assisting them with the essential care that they give to their patients and owners.
Super Cooper, you are.
This busy clinic is run by a huge team of 13, from veterinary surgeons to nurses to support staff.
Good morning, Grove Vets. Alice speaking.
They have over 3,500 patients on their books, dealing with everything from checkups to emergency surgery.
Right then, I just need some clippers for that.
One of the most common issues for dogs is gum and tooth related. And on average, vets can treat 7 to 10 cases a week.
Hello, sweetie.
And this Romanian rescue dog called Mouse has been admitted into the clinic for just that.
Yeah? You lie down and get some snoozy-woosy?
Mouse, que dia é hoje? Hoje é domingo. Mouse, he's 11 years old now. He has a character. He's very defensive, but he's a very good dog. He's a crossbreed Chihuahua, Jack Russell, and something else. He has been with us for 10 years, and he's the best friend I could wish for. I love him so much that I cannot describe with words. I will do whatever I can to give him the best life he can have.
It was during Marta's routine care for Mouse that she noticed something unusual.
Mouse, well, he's a very healthy dog. So one day I was brushing his teeth and I realized it had a lump, but that on the top of his mouth. So I decided to take him to the vets to check if it could be something harmful. It's better to be safe than sorry.
Mouse is in safe hands with vet James, veterinary nurse Beth, and yours truly.
Just going to pop another Inco pad under, if that's all right.
He's been given an anaesthetic to keep him still, whilst James assesses the lump in his mouth.
He does look like a little fox,
He
doesn't
does look foxy, doesn't he? It's very difficult, just by the look of the lump, to tell you kind of what it might or might not be. So the only way to know for sure is to take some sort of biopsy. We'll then see what the results come back as.
All lumps and bumps need to be looked at.
Yeah.
Yeah.
It's fairly common for dogs to get lumps. They can range from benign cysts to cancerous tumours, so it is essential you get them checked by a vet.
Here you are, soft boy.
Okay, so everything's had a good clean up, so we can now sort of see what we're dealing with. This is the lump here that we're going to try and just either biopsy or take off. The tooth that's underlying it, you can sort of see, if I use the probe, you can kind of go up either side, but the thing that worries me is that I can also put it all the way in that way too. So that, you can see, is coming all the way through.
Oh, so that's coming out?
Yeah, so that tooth needs to come out because that's no longer viable.
An infection between the lump and the tooth has caused the gum to disintegrate. James has to take out the tooth and its roots before he can remove the lump.
There are also a couple of other little teeth that are wobbly as well. So we've got a wobbly one down here, I can get the probe right down. And we've got a root there, I can get that probe right up there as well. So a couple of teeth to come out.
Not unusual in a dog his age.
No, no.
Right, and how's he doing, Beth? Is he all right?
Yes, he's doing really well.
So, that tooth where the lump is, you've got him out.
Yep, tooth's
There he
out,
is.
which is good, that's come out nicely.
Yeah.
So now I'm going to just take
Have a look at that lump.
as much of that lump away as I possibly can. With most lumps, the quicker they grow, sometimes often that's the more discerning they are.
Yeah.
Animal owners, we don't normally just open up their mouths and have a look. So interesting it was found.
Yeah, so that's one of the big reasons why we recommend routine health checks.
Okay.
Okay, so if you'd be happy to hold up like that.
Finger. Oh,
that'd
okay.
be
Both
really
thumbs.
helpful.
How's that?
That's really great, thank you.
Good. Neat.
Okay, so there's the lump.
All right.
There you go.
Nice. Off to the lab.
Absolutely.
Off it goes.
Yeah.
Now the lump is removed, James stitches up the hole left from the extraction. Mouse will be brought round and cared for by the nursing team till he's ready to be discharged back to his owner, Marta. Around 24% of dog-owning households in the UK have more than one dog. Having multiple canines might mean double trouble, but there are benefits. Learning and interacting with each other is great for their well-being and physical health. And these King Charles Cavalier Spaniels, Coco and Luna, are a prime example.
It's mine. It's mine.
The kids have always wanted a dog, and we went up to see a breeder in Birmingham. And we initially looked at Luna, and then we saw that Coco had not been sold yet, and we kind of fell in love with her as well. And so we ended up coming back with 2 dogs, which was great. So 2 dogs, 2 children. Definitely got our hands full.
There you've got traits. Okay.
So I had the King Charles Cavalier as a child, and my gran had one as well, so I've kind of grown up with them. And they're just a lovely breed. They're very friendly, they're great with kids.
We love Coco and Luna because they're just cute. They're nice to cuddle, and often we take them to bed with us.
Coco and Luna are due to be spayed, a common procedure which can stop pregnancy and reduce womb infections.
Let's go. Come on, girls.
And today, Anthony has an appointment with veterinary nurse Beth to discuss the procedure.
Come on. Come here, Luna. I'll lift you up.
Oh, thank you, yes.
There we go.
Okay.
Now, full of beans this morning.
Oh. So Coco's here for her lap spay today.
That's right, yeah.
Oh, bless her. What I'm going to do is I'm just going to have a very quick feel of her tummy.
Your sister's still here.
And just check her mammary glands. Okay, so she is producing a little bit of milk from her mammary glands.
Okay.
So she might be in a phantom pregnancy.
Right.
Those mammaries are quite enlarged as well.
Phantom pregnancies can occur from around 6 to 12 weeks after the end of a dog's season. The female acts and feels pregnant, lactating, nesting, and mothering toys.
I'll have to chat to Andy and see where he'd like to go with that, if he'd be happy to go ahead still.
Okay.
Just whatever's best for her, really.
Yeah.
Before they proceed with the spay, Beth requires a second opinion from vet Andy, as he'll be the one performing Coco's keyhole surgery.
How old is she?
She is just coming up to a year. Now, the problem with a phantom pregnancy is that the hormones will change them behaviourally.
What would happen then? What sort of behaviour issues?
Mainly just being a bit on edge, I think is the best way I would describe it. You know, you've got to think that the reason
we understand.
The reason that these things happen is because they're pack animals. So if they were to have a season in a pack, not be mated, it actually benefits the pack if she has the ability to produce milk, because she can actually feed other puppies that are not her own. But that still comes with all of the kind of anxiety and hormones that are involved with looking after puppies, which means she's going to be a bit more reactive. And what we don't want to do is spay when they're in this phantom pregnancy, because what happens is she'll stop going through these hormonal cycles and she will stay in that hormonal state. She still has a bit of milk. Is this just leftover, or is she still actively in the wrong hormonal state? Which means that we've got a decision to make, and I'm going to have a conversation with the owner just to decide whether or not we postpone the spay, or whether or not we're going to give it time.
Right, go and do that,
Right,
and then
let's go
I'll
do
wait
that.
for the
Shall we go?
result.
Okay, brilliant.
Okay.
Right, see you in a bit.
Thanks, yeah.
So yeah, it's annoying. It really is. That's quite frustrating for you guys, but I mean, it's not the only one.
It's very important that Anthony knows what the choices and the options are, so he can decide whether to go ahead today or delay.
All right.
Yeah.
Cool. Brilliant.
Brilliant. Thank you.
Decision made?
Decision made. Yeah, they're under no sort of time pressure, so it just makes sense. It's the right thing for the dog that we'll just take a step back, have a cup of tea, and then focus on my next case. All right.
Cup of tea then.
Lovely.
Let's do that first.
Right, let's do it.
Yeah.
Andy has prescribed Coco with a hormone reduction treatment to help move the phantom pregnancy along. Then, all being well, she'll return for her operation in 3 weeks' time.
Uh-oh. Vet bills? Don't worry, Dad. I'll eat them. Ha ha! See you later.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Keeping on top of our pets' health is paramount, and 41% of owners take their furry friends to the vets more than once a year. Our next patient is Bosun and his owner Nick. They're here to see vet James about his sore paw.
Hi, have you got Bosun? Here he is. This is Fern.
Hello.
Hello.
How do you do? Nice to
Right.
meet you.
He's just a completely lovely boy. He's full of energy, full of beans, but I've known him since he was a youngster.
I love this black and tan.
He's very excitable.
Excitable. Right, okay.
Yeah.
But hello, darling. But he's a, what breed is he?
He's a Doberman, yeah.
Doberman.
yeah,
With
yeah.
floppy ears.
With floppy ears and a tail.
In the olden days, they didn't do floppy ears, did they?
No, this is one of the reasons I absolutely just adore Bosun, because not only is he such a lovely personality, but he's fully intact. He's got his ears, he's got his tail still.
Gosh.
You know, and it's just so lovely to see. When you see Dobermans, often you'll sort of see them with those pointing up ears.
Yeah.
We in the UK are not legally allowed, quite rightly, to crop a dog's ears. This is what we call ear cropping. And it's often performed without anaesthetic, and it's done on puppies, and it's a horrible, horrible procedure. There is no benefit to the dog at all, other than to kind of make them look a bit more, should we say, a bit more fierce? Shall I show you some pictures?
Mm-hmm.
We're almost at a point where people think that this is normal,
That's the
and this is the problem, because actually that is completely man-made. It is a mutilation.
And how have they made it to stick up?
So what they do, as they're puppies,
Yeah.
only sort of weeks old, they literally make an incision along the ear, and then they use what we call stirrups. So they tape their ears in an upright position with these kind of plastic rods. Then it stays like that for a few months, and then when they take the stirrups off, they sort of fuse into this upright triangular position. And the people that do it, sort of, they say it helps against things like ear injuries, but all of the science points to say that there is just no benefit to the dog whatsoever. It's purely aesthetic. So ears, full stop, illegal to crop ears in the UK.
Previously, many dogs have come into the UK from other countries where cropping is still legal. But it is now illegal to import dogs with cropped ears.
As a vet who feels passionately about animal welfare, you know, ears and tails, they have a purpose, and that is communication. You know, for a dog to not have their ears, it sort of renders them unable to communicate as well. So it's not just a how they look thing, it's actually the function of their anatomy.
It's to tell you how they're feeling, are they excited, are they miserable, are they...
You know, you could almost read a whole mood by a tail alone.
Is he fast when he's out?
Terribly fast. He's like 2.5 bags of cement travelling at 42 miles an hour.
Oh, crikey. Okay.
Yeah.
Yes.
He's a very, very quick dog.
He's got a bit of a sore paw at the moment, hasn't he? How's that doing?
I put the cream on. He sat in front of the fire and licked it off, and he loved it. So,
okay.
So I'm not sure if it's working or not.
Let me have a little look at it. Let me have a look. So it was his left. It was his left, but wasn't it? Hello. Oh, I do love you. You're a good boy. Let's see here. So I know.
Oh.
It does look a bit less red, actually. That's good. The more we use that cream, hopefully the less that will happen as well. So yeah, just keep going as you are with that, because it'll get there. But keep us posted, and then hopefully in a week or so that should be settled right down. Yeah. Right, here we go. Good boy.
Paw injuries, like Bosun's, are usually covered by pet insurance, but always check with your policy provider.
Right.
We'll let you get on your way.
Thank you very much, people.
We'll see you again.
Okay.
Nice to see you.
Thank you.
Bye, Bosun.
With all the comings and goings of a busy clinic, everything has to be meticulously planned. So, daily catch-ups with head veterinary nurse Ella are vital.
We're very lucky to have the entire vet nurse team here. No phone calls at the moment, nobody coming in the door, fingers crossed. So it's very exciting that when you get a pause like this in the day, you can actually go through the briefing of what happened yesterday, today and tomorrow.
Exactly, so we just kind of all group together because we're all here, there and everywhere, so catching up just helps us streamline how the days go.
Okay, so this is an official huddle. Tell us what you're doing for, well, what are we doing today?
So next, if things go sort of in order, I think we'll be doing Zen for his castrate. Bloods have been taken, we'll just have to remember to spin those actually. And then just get those ones run.
Hang on, there's not, yes, because you say the word huddle, this That's not the crew messing around, is it? That is actually somebody. Do you want to go? Somebody want to go? Oh, go on, Alice. Quick, well done. Yeah, carry on.
And then I've also got Michael for a DMAT later, and we're doing that together, aren't we?
Okay, that'll be fun. Yeah, great.
Obviously, we'll catch up with all the owners when things are done. I guess, are you guys happy getting all the meds and discharge instructions ready?
Yeah, absolutely. I can do that.
Fine. Perfect. You've got clinics later.
Yeah,
so-
afternoon full of clinics. Can't wait.
Have you got anything exciting?
Who do you meet in clinic?
So we usually weigh our young puppies and give them their flea treatment, usually. Or post-operative checks. I think I've got a couple of those, just make sure patients are doing well.
I can hear one client who's going, "Roo, roo, roo." Who's that?
Zen.
I think that's Zen in our kennels, actually.
Zen. Oh, poor Zen.
Yeah.
Oh, well, it'll all be over soon.
Whilst I get ready for my next appointment, vet Amy is in with 4-year-old lurcher Zen.
Are you happy to turn him up into his back?
He's had his pre-meds and is ready for what is a very standard procedure. Assisting Amy is Nurse Georgia. She'll be monitoring his general anaesthetic.
He's quite a bold dog, so I've not got any worries about taking his testosterone drive away, because testosterone's a real confidence-giving hormone. In dogs that are a bit anxious or nervous in certain situations, if we remove that testosterone too early, then that can have a negative impact on their behaviour and could potentially cause a bit of fear aggression. So we're a bit more reserved about castrating male dogs now.
Castration can help prevent illness like testicular cancer, but always seek advice from your vet on the best time to neuter your pet.
So we start by making a little incision in the skin. So you just make that sort of midway between both testicles so that you can both come out of the same hole. And then you pop the testicles through. And there's a ligament that holds the testicle to the inside of the scrotum, so you break that down. So greyhounds and lurchers have a tendency to bleed a bit more than other breeds. So we've given a drug to help promote his clotting.
Castrations like Zen's and Spays are the bread and butter for this clinic, with the vets performing, on average, 10 to 15 a week.
So that's one testicle removed. And then we basically just repeat the same, but on the other side.
For an experienced vet like Amy, a procedure like this should only take around 20 minutes.
So we've removed both testicles now, so there's no bleeding. So next what we need to do is just close the hole that we've made effectively. So I'm going to suture this subcutaneous layer, and then I'll put some sutures in underneath the skin. And that will be our procedure done. Could I have a motorbike, please? Yes.
8 out of 10 Brits say their pet is the love of their life. So much so, we spend around £1,400 a year on treats, toys, food, and daily care. One much-loved pooch is Coco.
Yeah. Come on, Coco.
After 3 weeks of hormone reduction meds, she's back with her owner, Anthony.
Come on, here you go.
In the hope her delayed op can now go ahead.
Hi, Anthony. Have we got Coco?
Yes.
Lovely. Come on
Come
through.
on then, Coco.
Veterinary nurse Leah needs to check Coco's phantom pregnancy has ended before they can proceed with the lap spay, keyhole surgery to remove the ovaries.
Coco, you're so brave,
There
aren't
we
you?
go.
Well done. Lovely. So we're just looking for any sort of milk production. There is a teeny bit coming out of the teat there, but it is more of a clear colour. Normally when it is clear, it does kind of mean that it's on its way out, basically. Not normally covered by insurance sort of routine procedures, but is she insured at all?
Yes, she's insured.
Lovely. Do you know who she's insured with?
By Pet Plan.
No worries.
With the all clear, Coco will now be prepped for surgery with some pre-meds. Coming up, Pussycat Michael has tangled himself up in knots.
He's not quite grooming himself as well as he used to be.
Oh, lazy boy.
And James steps outside the vets to visit a rehabilitation centre for some rather special pups.
What are the kind of the more common reasons why seals might end up here?
So if there's rough seas and things, they'll get thrown up against the rocks and injured, or they'll get pulled away from their mum and orphaned.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Uh-oh. Vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Spaniel Coco has been sedated and taken to theatre ready for Andy to perform keyhole surgery to prevent this pup from getting pregnant.
Can we just make sure we got propofol in the actual IV just in case we need to give it quick?
He will be assisted by veterinary nurses Ella, Leah, and I'm here for moral support.
So here we go.
So here we go. So this is, I mean, there are lots of fiddly parts in a keyhole spay.
One of the more fiddly parts is getting access into the abdomen, because I'm making a tiny little incision, so trying to find the right spot. This is right in the middle. If you imagine a six-pack,
Yep.
it's the line between the two sets of abdominal muscles.
Okay.
It's a bit of connective tissue.
And this is less scarry.
It's
Is that
less,
right?
it's less traumatic, and we're dealing with much smaller incisions, which means that you have quicker recovery times. There's been a recent study that shows that alongside those quicker recovery times, you actually have fewer complications.
And this lump here, I just thought, oh, is that a tummy button? What is it?
So that is an umbilical hernia. Now,
Oh.
that's just a lump of fat, and actually the hernia itself is tiny, it's millimetres. I did give Anthony, Coco's owner, the option, and we discussed whether or not we wanted to correct that or not. The problem is, to correct that, we would have probably had to have done a traditional spay. And given that the hernia is very, very small, highly unlikely to cause any problems at any stage, Anthony and Coco's family decided very reasonably that they wanted her to have a keyhole spay, and we'll just leave that little, what I would consider more of an outie belly button more than anything
It looks
else.
like it, doesn't it?
This is a tricky bit. If I get this wrong, I will poke something I shouldn't poke. We don't want to do that.
It always looks very brutal.
Yeah, it is. This is one of the more risky parts of the procedure. This is my ports, this is all my surgical ports, and I'm going to have a camera port just over here.
Oh, I see.
When we do keyhole surgery, what's really important is that we've got room to operate. So what I'm going to do now is we are going to what we call insufflate. We're going to put a bunch of carbon dioxide into this abdomen and balloon it up.
Coco's abdomen is gently inflated with carbon dioxide, a safe, body-friendly gas that gives the surgical team space to work with precision, making the delicate procedure much safer. Andy has now created 2 ports, which will give him access to the ovaries.
So I've now got abdominal access. So we're just going to have a look in there on that
is your
screen.
camera?
Yeah. So we're fogging up a bit. So I'm just going to. We're good. No bleeding. We're all good.
What's that?
So that's the liver.
Uh-huh.
That's the gallbladder.
Nice.
That's the diaphragm with the heart beating on the other side of it
Oh, isn't that
in the
lovely?
chest.
How much practice do you have to do to be qualified for this?
My general feeling is you probably need 20 under your belt to go solo with someone in the room to back you up. And I don't think you should be doing these. Such a bold statement, but I would say, I think 100 surgeries under your belt to be confident doing them without necessarily having backup. So what we got here, Fern, is I've got the uterus there.
Just
coming up to the ovary in there, and that's my temporary stitch. And the reason I do that is so I'm holding it up and out of the way.
Where's the stitch? I can't see it.
So you can see the stitches, see that there, that blue bit there?
Oh, goodness.
So I'm all the way
So
through, so just holding it up. And what I'm doing is I'm keeping it out of the way,
Yeah.
because what we're going to be using to dissect this off is heat. And the last thing we want to be doing is putting heat near anything that doesn't want it. So what we're doing here is just cauterizing these vessels. I'm now going to go in with some scissors and give them a snip.
Look, can I just see them? And they're so tiny. Oh, see the smoke.
Smoke and bubbles. So I'm pretty happy.
Okay.
Right, so that's now dissected off.
Well done.
So the next challenge is going to be pulling this tissue out of what is
yes.
a tiny little hole.
Yeah.
I'll tell you what.
Does this mean that she's never going to have another season? So
Well,
she's done?
Yeah, as long as I've done my job properly and I've got all of the ovary. So that's the ovary sat within the tissues. I'm now confident I've got all of it on that side, so that's perfect.
Yes.
So, one side done.
This surgery takes around 35 to 45 minutes, which is generally a bit longer than a traditional spay. And it is more expensive due to the advanced technology and experience required.
It's just a very different procedure to any traditional because your fingers aren't feeling it, you're at a distance, so all of your usual senses that you're using aren't necessarily helpful to you.
No.
And the other thing is you need to be as much an engineer.
Oh, there we go.
There we go.
There it is. Just popped out.
Both sides have gone really smoothly. I'm very, very happy. So where we've sealed across here, no bleeding, no bleeding, no bleeding. I'm very, very happy with all of that. Right, can I have CO2 off, please? Now let's let her deflate.
Not too big a scar to close up.
No, not at all.
Coco's been a dream, bless her.
Yeah, she's been doing great.
The final step is a few dissolvable stitches.
Okay, it's Coco done.
Nice job.
It's just time to wake her up now. Let Leah take over with the waking up. But yeah, everything's gone very well.
Recovery time is 3 to 5 days, so this pup will be back on her paws in no time.
Hello, lady.
Still on her back at the moment, but we'll move her over now. There we are. You okay? You are. She's living her best life.
Our next patient is a 3-year-old fluffy feline.
This is Michael?
This is Michael.
Oh, Michael, how nice to meet you.
Michael is booked in with veterinary nurse Georgia and myself for a DMAT.
He feels very silky on the top, but under here, it's like horrible lumps.
Yeah, so he has quite long hair, so I think it's the underlayers that are getting knotty. So it's either that he's not quite grooming himself as well as he used to be.
Oh. Oh, lazy boy. Hello. I see you have clippers and things here. I've never used clippers, so... Oh, darling.
We'll do our
you
best.
stay with me. I'm in charge of tickling.
Yeah.
So, do all long-haired cats have to go through this, or is it just some unlucky ones?
Not all of them. It is more common, obviously, with longer hair because it can just get more tangled. But it can happen more with older cats because sometimes they can get a bit more like arthritic and things. So they don't want to bend round, they don't want to clean themselves as much, and they get like, so to say, a bit lazy.
Yes, yes. Would you be tempted to go with scissors first, just to cut the major bits off?
So I wouldn't, just in case you cut the skin underneath, because you're not quite sure when it's this close where it is. And obviously you're going to cause yourself more problems if you start cutting there, and it's going to be a bit uncomfortable for the cat as well.
Yeah.
Yeah, so it's best just to go in nice and slowly, clip away at it.
Take your time.
Yeah, basically, and he's tolerating it quite well.
He
so
really
there
is.
Isn't too much of a rush.
To avoid your kitty getting in a tangle like Michael, long-haired cats ideally need brushing once a day and short-haired once a week.
I know.
Oh, no.
You
He's hiding himself in me.
Oh, he likes you.
Yeah, well, I like him. Has he been here before to have this done?
Yeah, so it looks like he comes every once a year or so to have it done. Maybe we'll recommend him coming every 6 months if it's like this.
Yes.
Nearly getting this big piece off now.
As a cat owner myself, I know how tricky this can be, but Michael's been on his best behaviour, although I am now covered in fur.
There is a lot. It's like shearing a sheep.
Yeah, look at that.
Whoa.
There's a good boy. You're done.
Well done.
Well done, Michael. What a lot of... Look at that. Isn't that incredible? Don't lie in it, mate. No. Oh, it's a pillow. Right, okay, fair enough. You've got to go home now, mate.
I don't think he wants to. I think he's happy.
It's been 2.5 hours since Coco's laparoscopic spay. She can now be discharged and reunited with her family. She will need to wear a protective suit for a few days to allow her wound to heal.
Just keep her cool, calm and rested.
Yeah.
Come on.
Brilliant. Thank you very much.
It's okay, we'll see you in a couple of days.
Veterinary careers are as diverse as the animals they care for. Vets can focus on exotic, farm, or wildlife animals. Today, James is stepping outside the clinic to visit a dedicated rehabilitation centre for some rather special pups. And I don't mean the four-legged kind.
I'm on my way to an animal rescue centre that is unlike any other because it is the place to go if you are a seal pup in need. I've been here before. A few years ago, I operated on a seal, and it's somewhere that I'm just always excited to check back in with and see what they've got going on.
The mission at RSPCA West Hatch in Somerset is to rehabilitate and release wild animals back into their natural habitat.
In a month, we would see around 400 wildlife admissions, typically through the summer. Over the whole year, we would see up to about 3,500 wildlife casualties. Our vets carry out life-saving surgery all the time. It could be removing a hook from a swan, it could be a dental on a seal.
The centre is currently caring for 40 orphaned grey seals. So James is meeting up with wildlife assistant Kirsten Hockin to learn a bit more about their work.
Who have we got here?
This is Lizzo.
Lizzo?
Yeah.
Lizzo, like the pop star?
Like the pop star, yeah, that's our theme for this year. So we've gone with artists and bands. Well, yeah, as you can see, they've got
right on cue. She's hitting those notes.
She is, yeah, she's...
Oh my gosh, she's absolutely beautiful, isn't she? What's her story? Why is she here?
She came in originally from the Seal Hospital down in Cornwall. When she was picked up, she was just really skinny, but when she got to us, she had an ear infection. So we've just been trying to get on top of that with lots of antibiotics, which I think, luckily, we are about there.
The grey seal population in the UK is a healthy 162,000. But recently, centres like this one have seen an influx in pups that need care.
What are the kind of the more common reasons why seals might end up here?
So if it's rough seas and things, they'll get thrown up against the rocks and injured, or they'll get pulled away from their mum and orphaned, and they'll come in. And occasionally they'll get bite wounds from other seals.
So how long will she be here for?
We'll probably have her for at least another sort of 3-4 weeks, and from there, once they're feeding themselves, once they've got the weight on, we can move them out.
When youngsters like 3-month-old Lizzo arrive, they're malnourished, so the team gradually wean them onto solids. And on the menu, a kilo of herring 3 times a day.
So, and literally just fling it in?
Yep.
Yeah, okay, go. And that's pretty much down in one.
Yeah.
Played to her.
Yeah, which is what we want.
Come on, Lizzo, number 2. Ooh, slippery sucker. Ready? This is great fun.
The mission with our wildlife casualties is to always get them ready for release again. We want them to be healthy, we want them to be strong, we want them to exhibit the same behaviours as their wildlife counterparts. They need the pools, they need the space to swim, grow muscles, and just develop that strength before release.
So who do we have here?
We've got a very large selection of celebrities here, ranging from Tom Jones, Bruce Springsteen, Lulu. Some of them only came in here yesterday, so they're a little bit wary because they were with maybe one other seal and now they're with 12.
Yeah. And this is all about teaching them competition.
They come onto our deep pools so that they can get fit, get used to kind of being suspended in the water, and also to socialise, to get used to competing for food. In the wild, they would be in big haul-outs on the beaches, so they do need to get used to being around a large group of seals, and this is the perfect place to do it.
So that they learn those seal manners, but also stand on your own 2 feet a bit, well, own 2 flippers, and sort of stand up for yourself.
Exactly.
How does that feel when you release them?
Oh, it's amazing. Some of the places we've released them, it's almost like they can smell the salty air.
That's crazy, isn't it? And I bet that's got to be a perk of the job when you see that.
Oh, absolutely. It's why we do what we do. So, yeah, it's worth it.
Coming up, a claw clipping masterclass.
Have lots of places for your cat to scratch on.
Oh,
that helps.
armchairs, sofas, new carpets.
As expensive as they can possibly find, yeah.
And Mouse is anxiously waiting for his results.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
The first patient I bump into as I start my shift is a familiar face.
Oh, hello.
Morning.
Hello. Now, is this Coco or Luna?
This is Luna, so...
Ah, so Coco. I thought, no, Coco wouldn't be jumping about. She's just had her spare, hasn't she?
Yeah, so she's recuperating at home.
Yes.
She's much better now.
Brilliant. Good to see you, Anthony.
Brilliant.
Thanks very much. See you another time
Yes.
then, maybe.
Nice to
Okay,
see you.
bye-bye.
Bye-bye.
Bye, Luna.
Come on.
Regular health checks at home may help you notice any changes in your pet. Spotting issues early on could make a difference. So, as I have a vested interest in this as a cat owner, James has offered to give me a mini masterclass on claw clipping with British short-haired Sprocket.
So claws are very useful for our cats. They need them to scale trees, to get over fences, possibly to defend themselves, but they can overgrow as well. So what I would always recommend with claws is to have lots of places for your cat to scratch on to start with. So scratching posts are a great option there.
Oh,
that helps.
armchairs, sofas, new carpets.
As expensive as they can possibly find, yeah. And what that does is it not only helps them to sharpen and maintain their claws, it's great for back strength, they're stretching out. It also deposits pheromones onto wherever they're living, so it's a bit of territory marking. So there's lots of benefits to having cats keep their claws quite long and quite, they do use them, but some cat breeds, and especially older cats, they might have claws that then grow round into the pads. So if that's the case, then yes, I think it is worth clipping them. So let me show you with Sprocket where we would ideally clip to. So you can just see a little pink kind of triangle just there.
Yes.
That's the quick. That's where the nerves are, it's where the blood vessels are. So if we clip there, they're going to bleed. So we need to give a lot of space between the nail tip and there. But what we can just do is take those tips off. So it is easier if you have somebody else to help you. So and I'm going to ask you to be our general help here. So if you kind of cuddle them into you, and then if you pull one foot out at a time.
Okay.
So we just clip.
And these are special clippers.
Yeah, so what we want to use, ideally, Good boy.
It's very good.
Ideally, these sort of scissor-type claw clippers, I think, are much better than the guillotine type because they give a much cleaner cut.
Yes,
There we go.
controlled.
Let me show you a look in this one. So if we just gently, if I bring
sorry.
that. No, that's okay. Sometimes if you put a little bit of pressure behind the elbow, it just helps to bring the foot forwards. That's
I've
a
learnt
good one.
something, thank you.
So again, you can sort of see you've got the triangle just there, so we can avoid that, and we just take the last little tip there. So I'm not taking much at all, but I'm just taking those last little hooks off each nail. He's very good.
He's so good.
This is something that lots of people request us to do whilst their animals are under anaesthetic or sedation, because not every pet, again, is going to let you do this quite as amenable as Sprocket. So it is something that you can definitely do from home if your pet will allow it. And again, it's not always about having to do every single nail, every single time, all in one go. Sometimes just 1 or 2 nails at a time. Keep things positive, use praise, use lots of rewards.
Gosh, he's relaxed. This is the zenest cat I've ever met.
It's great, isn't it?
Isn't he?
It's been 6 days since 11-year-old Mouse came into the clinic to have a lump removed from his mouth.
Good boy. Here. Because we had to put him under anesthetic to remove the lump, I also did some dental treatment and it went well. He can only eat soft food for this week, and so he's been very spoiled. I don't know how I'm gonna get him back to the dog food after this.
Despite losing a few gnashers along the way, the biopsy results have come back and it's good news for Mouse.
It was a relief to get the call. Everything went well, so I'm happy with the results.
Thankfully, the lump was benign and no further treatment is required.
It was a positive experience. I, as an owner, I get happy that everything is fine. I want him to have the best life and quality of life.
Good boy.
Having a nice time in there, in the van.
Next time inside the vets, Whippet Mr. Mole is rushed in after receiving a nasty throat injury.
I think the big question is whether there's any damage further deeper to the tissue and things. Hopefully this is just skin deep.
And Louis, the Jack Russell, proves to be a challenge for the vets.
There's definitely a big tennis ball size thing that I can get my fingers pretty much all the way around.
Never eat houseplants.
Fern, Britton, Inside the Vets, brought to you by Pet Plan.